Hello everyone, my name is Sam, I'm a GP. Today I'm going to present on a topic called causes of vomiting. Vomiting is a very common presentation to general practice. So it is very important that we have got a very solid idea of common and uncommon causes of vomiting. So let's begin. So here, in this table, I've got the common causes on the first row. Infective common causes include acute gastroenteritis, gastritis, which is inflammation of the stomach lining, vestibular neuritis, which is inflammation of the organ of balance in the inner ear, causing vertigo as well as vomiting. Next, we have got medication and drug use. The use of drugs, excessive alcohol, food, chemical, as well as certain prescribed medication can lead to irritation, therefore inflammation of the stomach lining called gastritis, leading to nausea and vomiting. Next, we have got migraine as another cause. Migraine is very common in the general population, more so in women than in men. It usually presents with vomiting associated with one-sided throbbing headache, as well as light and sound sensitivity. Next, we have got pregnancy as a cause of vomiting too. As the saying goes, a woman is always pregnant until proven otherwise when they present with vomiting. So this is a very important differential. Next, we have got the pediatric population. In the pediatric population, feeding problem can cause vomiting. Pyloric stenosis, a condition where there is a narrowing of the lower part of the stomach, causing food to back up, leading to vomiting. In this condition, the patient usually presented with something called a projectile vomiting and usually occur in children less than 3 months old. Next, we have got ketoacidosis. Type 1 diabetes can and usually presented with abdominal pain associated with vomiting. And it is an important differential that any practitioner should think about when they see a child with recurrent vomiting and abdominal pain. Developmental issue such as esophageal atresia, which is essentially poorly formed esophagus, intussusception, which is the movement of one part of the bowel into the adjacent part causing obstruction, intestinal mole rotation, or can cause vomiting due to obstruction of the gastrointestinal tract lumen. In elderly population, we have to consider a condition called Meniere disease, which essentially present with vomiting associated with vertigo, tinnitus, and occasionally hearing loss too. And in this table, I have put together a list of less common but potentially serious causes of vomiting. So let's go through them. First, we have got the infective causes. These include acute appendicitis, acute pancreatitis, acute viral hepatitis, urinary tract infection, septicemia, meningitis, which is inflammation of the lining of the brain, encephalitis, which is inflammation of the brain itself, otitis media, which is the medial ear infection, infective endocarditis, which is infection of the heart valve. They all can cause vomiting. Next, we have got neoplastic causes. These include cancer of the esophagus, cancer of the stomach, as well as any cancer within the brain that can increase the pressure within the brain, causing vomiting, usually worse in the morning. Next, we have got toxic causes. Poisoning with botulinum toxin can result in vomiting as well. Obstructive causes include paralytic ileus, where the bowel stops moving, acute heart attack, which is obstruction in the coronary artery, causing at times painless vomiting. Bleeding within the cerebellum also can cause vomiting too. Endocrine conditions such as diabetic Gastroparalysis is a condition where the stomach nerve has been damaged to an extent that it stopped moving. And other developmental causes, but rare causes of vomiting includes motility or functional disorders such as achalasia, idiopathic gastroparalysis, high calcium, and failure of important organs such as the liver, heart, kidney, or lung. Thank you for taking the time to watch my video. If you like my presentation, please kindly subscribe. And this is my disclaimer. Many thanks.